Now, France will close down schools for 3 weeks to fight a rapid spread in coronavirus cases. President Emmanuel Macron warned the country risks losing control of the pandemic if action is not taken. France's parliament is currently debating the new measures. These include a nationwide curfew and a 1-month ban on domestic travel. Well, the infection rate is surging in France, with almost 60,000 new cases reported in the past day.
Intensive care units in hospitals all over France are running out of free beds. At this medical center an hour north of Paris, their ICU is full and they've been forced to add temporary beds to cope. We feel this wave hitting us hard and we're hanging on. People need to be warned that they should not gather. We had a mother and her son die at the same time in 2 different intensive care rooms, all because of a family gathering. It's unbearable for us. It's a very difficult situation to manage. Spring weather has drawn people onto the streets despite the dramatic surge in COVID-19 cases. Images like these led medical experts to demand stricter measures, and the government responded. Schools and non-essential shops will close, and domestic travel is banned. President Emmanuel Macron pleaded for cooperation. In the coming months, each one of us must make an extra effort. This is what I ask of us collectively this evening. Macron also promised to increase the number of ICU beds from the current 7,000 to more than 10,000 and to speed up the sluggish vaccination program across the country. Unlike his European neighbors, Macron didn't tighten restrictions when numbers dramatically increased in January. The latest lockdown will be in place for at least a month. Macron hopes to reopen some cultural venues, even restaurants and cafes, by mid-May.
Let's go to our correspondent in Paris. DW's Lisa Lewis is standing by for us. Hi, Lisa. It's good to see you. We mentioned that the French Parliament is meeting. What measures are they discussing at the moment?
Well, absolutely. Members of the French government, such as Prime Minister Jean Castex, have come to Parliament to explain the measures that were announced yesterday by President Macron. The Prime Minister said, for example, that it would be banned to drink alcohol in the public space. He also appealed to the responsibility of the French to stick to the rules. But opposition politicians have already said that they're really unhappy about this way of going about things, because President Macron announced the measures last night and now Parliament is discussing about it. There will be a vote later on, but that vote will have no effect. So opposition politicians have said that they either would walk out during the vote or would vote against the measures.
Well, we heard President Macron saying there is a light at the end of the tunnel. I mean, what do people there in France think of that?
Many people here are welcoming the measures, the restrictions that were imposed last night, as in the lockdown, like that was extended throughout the whole of continental France. And they're hoping that this will be enough. But I've been talking to people in the streets today, and many have told me, you know, we know that there will be tough weeks ahead, but we don't know if these measures actually came in too late and if they're actually too little, because the numbers here, the infection numbers, are really skyrocketing. As you said in the report, and many hospitals are reporting that they are running out of intensive care beds, and doctors and virologists and people here in France are hoping that the measures will be enough.
We know that there has been speculation, Lisa, linking the AstraZeneca vaccine to possible blood clots. Has that made French people more cautious about taking this vaccine?
Well, the French are, in general, the world's most vaccine-skeptic country, according to polls a few years ago. And they're also very skeptical of AstraZeneca, of course. 60% are saying that they don't trust the vaccine. However, at this very moment in time, the vaccination campaign is actually moving forward quite fast. There are about 200,000 to 300,000 jabs per day that are being administered here. So for now, the skepticism of the French regarding AstraZeneca doesn't seem to have an impact on the speed of the vaccination campaign.
DW's Lisa Lewis reporting there from Paris. Good to talk to you. In the UK, more than 30 million people have received their first COVID-19 vaccine, but not to everyone is too eager to roll up their sleeves. Skepticism is especially widespread among minorities, even though they've been harder hit by the virus. Racial inequalities have led to deep mistrust between those minority groups and institutions. DW's Birgit Maas reports now from a district in North London where she met one man who was part of the campaign to fight vaccine skepticism.
The district of Brent in North London is one of the poorest in the UK, and it's one of the areas most affected by COVID-19. Here, it's even more important that as many people as possible get vaccinated. Longtime resident Umid Jani is committed to making this happen.
We could see that people are walking around, they're not sure who to turn to, who to talk to, how, where do they seek help.
The pandemic has exposed long-standing health inequalities in the UK. The government has now allocated £20 million to tackle this. So-called community champions are targeting those that are hard to reach, with phone helplines, workplace programs and just chatting on the streets. Umid Jani has set himself the task of reducing mistrust of the government and the authorities and dispelling myths about vaccination.
It's just another tool to control people in deprived areas, maybe. So we heard about microchips and stuff like that, which is preposterous. But more, it's, who else? Why should we listen to anybody? Why should we listen to anybody now? Especially given that no one's listened to us before.
Conversations with locals reveal their suspicion.
I do not want it. It's not gonna do me no good. Rather to kill me off.
I'm high risk and I'm not having it. I don't want it.
You don't want it?
No.
They are testing it on human beings and that's not right. That's why I'm not taking it.
Yeah. You do? Oh, you do?
Umid Jani can get some passers-by to talk to him, but it's difficult to convince those who flat out reject the idea of getting the jab. British health authorities have launched social media campaigns to combat conspiracy theories and vaccination myths.
The language we use, the messenger we use, and the message. And I think out of all of those, probably the messenger may be one of the most important ones. So if it's a trusted community member, someone they know, someone they can relate to, someone who looks like them, someone who speaks the same language as them, it's more easy to build a rapport and to understand what they're saying.
I've taken the vaccine.
Umid Jani doesn't simply ignore the argument that the vaccine could have side effects. He puts it into perspective, saying millions of people have had no major complications. And he cites scientific studies.
I can't impose my opinion on somebody, but I can certainly help them to say, well, look, don't take my word for it. Here's some places you can go and look. You already got your source of information. Here's some other bits. Try and get a balanced view on this.
Umid Jani was at least able to convince his own mother to change her mind.
Let's get some perspective on this story now with Kaltum Osman Rivers. She is a sociologist as well as a Green Party councillor from Sheffield in the UK. Welcome to DW. Now, the UK's Office of National Statistics recently showed that 85% of white Britons have reported that they were likely to get the shot. That's compared to fewer than half, so around 49% of black adults. Why is that?
Thank you for inviting me. I think, as you heard from the last person, there's a lot of suspicions, but main problem is trust and also misinformation that's getting to the communities in a concern. The black and minority ethnic communities and those who have been minoritized have also that mistrust with the health services. So as you probably have had many times that people are saying, why should we? No one listened to us. Now, those kind of words is the kind of that we had, but the reaction also comes from years and years of racial, structural racism within the public health and in health services. And health services that did not really reach the communities. Now, I say communities are not hard to reach. They actually seldom had communities. And without providing information in their languages and understanding the cultural context of these communities, I think years and years of missing out information is one of the bases.
Yeah, we heard a health official in that report say the messenger and the message is important. I mean, from your experience, what is the best strategy in speaking to people and building that trust?
Yes, I took my, I'm a locally elected councillor, and most people know me in the community. I speak Somali. So but myself and the Public Health Services and the NHS Clinical Commission of Sheffield got together. There are 8 of us from the minoritized communities, elected members. We've all done the videos of actually speaking the languages of those communities. I spoke Somali. I explained that I took the vaccine myself and explained the side effects. Completely outplay the if you get the COVID is worse. So basically, looking at the cultural context of the communities, we understand the language, but you also understand the culture. So yes, messenger is really important.
So how successful has that message been, for example, in the Somali community where you are?
It has been really successful, and I myself wasn't the only person who was doing that. There were young doctors who speak Somali who were also doing across the UK. British Somali Medical Association and health initiatives have done loads of videos as well. So those videos were targeted to actually the more older community members who have WhatsApp, who are in WhatsApp groups. And we realized that the only social media for people who don't speak the language, it's actually reaching them through WhatsApp. And it's been quite good. It's been shared a lot.
Okay. We'll have to leave it there. Kaltum Osman Rivers, thank you so much for joining us here on DW.
Thank you.
Now, India has expanded its vaccination drive to include everyone above 45 years of age. Already, health workers have administered more than 64 million doses. Yet the high numbers are only a small portion of the country's population. A recent surge in new infections has raised questions about why India is lagging behind on its vaccination goals.
Running this electrical supply shop in Delhi once took up all of Dalip Arora's time. Now, he spends some of it on volunteer work, helping those affected by the pandemic. While neighbors shrink away from COVID-19 cases, Arora always keeps protective gear handy in his car in case a patient needs to be rushed to the hospital. He believes his destiny is in God's hands, and his fear of the coronavirus shouldn't keep him from helping those in need. But so far, his fear of infection has not managed to overcome his doubts about the vaccine.
I have seen cases where people have been vaccinated and still they are having COVID. That's very important. They were not positive at the time of vaccination. They might have contact with a positive person. But then the vaccination, then what vaccination is doing? Why were they positive now?
Arora is aware that vaccine development typically takes years. And he does not feel comfortable getting a vaccine that was pushed out so quickly. He believes many others in India also prefer to wait and watch. And the low turnouts and lack of long queues at vaccination centers seem to be proving him right.
India is lagging behind its vaccination targets, which could be why the country has now made the vaccine available to everyone above the age of 45. Another reason could be to counter vaccine wastage.
In a meeting with state leaders, India's Prime Minister Narendra Modi emphasized the need to stop the waste of vaccine doses.
We must take the problem of vaccine wastage very seriously. In a way, every vaccine wasted is also a waste of someone's right to vaccination. We cannot destroy someone's rights.
Neighboring Uttar Pradesh has seen high rates of vaccines being wasted. Part of the problem lies in the perishability of the vaccines. Each vaccine vial has 10 doses, and once opened, they must be used up within 4 hours. If 10 people do not show up within that period, the remaining doses must be discarded. Vaccination centers like this one say there are simple ways to counter waste.
We only open the vial when we have 10 people waiting to be vaccinated. Some people call their friends. We call those who registered but couldn't get a vaccine. That's how we would make sure we have enough candidates.
People under 45 are not officially eligible for inoculation. Opinions are divided on whether they would take the jab when their turn comes.
People my age can't keep waiting for the vaccine. We can also get COVID. We should all get vaccinated as soon as possible.
We are young right now. I'm 25, I'm fit, so there's no need for a vaccine.
Once my age comes into that criteria, definitely I'll be going in as well.
For now, the government is hoping for a big surge in the number of vaccinations and has put its exports on hold. A sharp rise in daily infections may just cause a shift in gear in India's vaccine drive.
That report from DW's Nimisha Jaiswal, and she joins us from Delhi with more on the story. Hi, Nimisha. Does India have enough doses to really ramp up vaccinations even more?
Well, Sumi, the government definitely seems to be emphasizing that India does have enough doses to vaccinate everyone who is eligible with 2 doses. And there is credence lent to this claim by the fact that India has currently put its exports of the AstraZeneca Oxford vaccine manufactured at the Serum Institute of India in Pune on hold for over the last week especially. And this is seen as an action being taken as a consequence of India's ongoing surge in COVID cases. Today, the turnout at the vaccination centers has already been reported as positive because everybody above 45 is being vaccinated. In addition, the government has also announced today that throughout April, it wants both private and public vaccination centers to remain operational all 30 days, including holidays, another effort to bolster the vaccination drive further.
Nimisha, you mentioned this surge in infections. What has led to this increase in cases right now?
Well, for me, one of the usual suspects is, of course, that there's been a slackening in the precautions being taken by the public. People are out and about. There are no restrictions. There have been gatherings. But again, this was also true in previous months. In February, India saw an average case rise of around 12,000 cases, as compared to yesterday when India saw over 70,000 cases after months. So another theory is that mutations may have a role to play, and that this may cause a faster spread because, of course, all the mutations that have been found have been seen as being more infectious.
And we've seen that the surge also seems to have international implications as well. What can you tell us about that?
Well, one of the key aspects of India's vaccine drive has been its vaccine diplomacy. India launched its Vaccine Maitri or Vaccine Friendship program. Over the last couple of months, India has exported and even donated millions of doses. However, the country has put these exports on hold, and this is impacting the drive. There are concerns around the world about how this may impact the drive, especially in poorer countries, as India is a contributor to COVAX, which contributes to these countries. For example, in Nepal, where the drive was launched in January thanks to 1 million AstraZeneca Oxford doses donated by India, the vaccine drive is currently on hold, and people who've gotten the first jab are wondering when they'll get the second jab, because its purchase order of 2 million doses to India has been put on hold right now.
DW's Nimisha Jaiswal reporting there from Delhi. Thank you so much.